People have been overly generous and most generous and genuinely concerned for me getting better. And I truly appreciate all that and all the kindnesses that were shown to me and my family. I was shaving and I noticed a knot on my neck. Um, it was not very big and uh, I assumed it's just one of those things that happens when you get older. You get little bumps and lumps on your body. So anyway, I noticed it. I mentioned it to my wife. She felt it, and she said, "Well, let's just keep an eye on it." About a week or two later, it didn't go away. So I said, "Well, maybe I should get a doctor's appointment and at least let the doctor see." So I did. And I went to a regular doctor, and they said the same thing. Well, it's just a little knot. It's probably just a node. It's probably okay. Just keep an eye on it. And you've got a physical scheduled in next month anyway. If it hadn't gone away by then, we'll take another look. Well, by the time I went to my physical, which was probably in October, it had gotten a little bit bigger. It did not hurt or anything. And they said, this should not, this isn't normal. And of course, I didn't think it was normal from the beginning, but things happen as you get older that change your body. So you never know exactly what normal aging is because we've never done it until we do it. But at any rate, I went to, they said, we'll send you to an ear, nose, and throat doctor because it was on my throat. I mean, it was on my neck. Right. So I went to that doctor and they said, well, this is a little bit abnormal. Why don't we, and I'm not sure what the technical term is, but basically, why don't we stick a needle in it and pull some cells out and see if there's anything unusual inside or whether it's just a lymph node. So when they did that testing, they said shows some abnormalities that would be consistent with cancer, but in order to get a full diagnosis, you're going to have to come back for a procedure. So they scheduled that, I think, it's either late November or early December, where the doctor went in and with one of those camera devices, again, I'm not good with the medical terms, but basically went in and biopsied, took tissue samples from the node and looked at my tonsil tongue area, which was where the abnormality was. It was at the base of my tongue on my tonsil, and concluded that it was cancer consistent with cancer that arises from the HPV virus. So, of course, I came along in a generation where there was no HPV vaccine. So I can tell you now, having gone through all this, this is probably an HPV virus I contracted in my teens or early years that has laid dormant for many, many years in my body. So I would highly encourage all young people who are eligible to get the HPV virus to get it, because if you can avoid the cancer I've gone through and the treatment I've had to endure, it'd be well worth getting that vaccine. And so I know it's recommended certainly by most pediatricians, my wife and others, and not everybody gets it, but it's something you really ought to consider, because if it can save you from getting throat or tonsil, tongue cancer, it's well worth it. Because ignoring a health problem is not going to make it go away. Notifying somebody who knows what they're doing that you might have a health problem allows for early diagnosis, early treatment. And the earlier, I'm convinced that I got almost as early a diagnosis as I could have. I got good treatment from the beginning, that had I ignored it and let it malinger, that cancer would have spread across my neck and it would have been harder to treat and maybe had a not as good outcome. So it's important for early diagnosis, early treatment.